Greetings, dear students. In today's lecture, I am going to talk to you about medical history taking, the art and science of medical history taking. What are the steps? What is the importance? And how to take an effective history from a patient. My name is Dr. Aurangzeb. I'm a consultant cardiologist working at Sedu Teaching Hospital, Swat. Let's begin our lecture. Medical history taking is a crucial process that helps healthcare professionals gather essential information about a patient's health status, symptoms, and medical background. This is the basic purpose of medical history taking. In other words, you have to interview the patient in a manner that helps you gather information from the patient regarding their illness, regarding risk factors for various diseases, and all this information that you gather in your detailed history will help formulate an effective management plan for the patient. Medical history taking forms the foundation of clinical decision making and accurate diagnosis. It helps identify risk factors, determine appropriate investigations, and develop an effective treatment plan. Before you start taking history from the patient, there are some essential prerequisites which you have to follow in order to complete your interview. These are: ensure privacy. History taking should place where there is an environment of security and privacy so that the patient can provide you with important information without the fear of being disclosed to someone else. Always introduce yourself to the patient so that the patient knows who you are and why are you conducting this interview. Make rapport with the patient by welcoming the patient and by some formal questions. Say, for example, hello, Mr. XYZ, nice to see you. Did you take your breakfast? Things like that, so that the patient understands the purpose of the interview and he starts believing in you and start trusting you so that information is not hidden from you. Explain the purpose of history taking. Always instruct the patient that why I am taking this history, what is the importance of history, what is the importance of the past history, the medical history, the drugs that you are taking, your previous treatment records, any allergies, any family history. Every step should be explained to the patient. And ensure that the patient is comfortable during the interview process by respecting their beliefs, respecting their cultural background, not asking too many leading questions, not interrupting the patients in between the interview process. Let the patient speak out as much as they can. This will give you valuable information and important clues. So at the end of the interview, if you feel that there is a need for some leading questions, you can take help from the patient's history as well. Be empathic to the patient. Always show the patient that you are listening to them and you are taking their concerns seriously. At the end of the interview, always reassure and thank the patient. Okay, so these were the preliminaries for history taking. Now, what are the key components of medical history? We start the key components of medical history and the importance of those components in this slide. The first and the most important thing is obtain identifying information from the patient. These include the patient's name, their age, the gender, the occupation, contact information of the patient. Each and every component has their own significance. You can gather important information from the name of the patient. This will give you some cultural affiliation of the patient. Geographical attributes can be judged from the patient's name. The religious beliefs can be judged from the patient's name. Not only by name, you can call the patient and that's an identification for the patient, but also it gives you extra information, so you have to be careful about that as well. The age of the patient is also important because disease tends to run in age groups. For example, pediatric age group has its own conditions. In the young population, you will find other conditions. In the older people, you tend to find chronic diseases. So age is also important. Gender is important. Occupation, very important. particularly if you are dealing with a person who has been in a particular occupation for a longer period of time, and you are suspecting some occupational health diseases in those patients. Also, occupation tends to impact the patient's disease as well. Uh, Also, the source of income of the patient is determined from the occupation, so that whether or not they can sustain their health needs or not. In certain conditions, a patient can, for example, a patient with syncope or patients with seizures, they have to change or switch their occupation, which are high risk. Contact information from the patient will give you clues regarding where the patient belongs to and how to follow the patient in the future. Next up is the chief complaints of the patient, and these are the primary reason the patient seeks medical attention. For example, a patient comes with fever, a patient comes with pain, a patient comes with headache, with cough. So these are the complaints which pursue the patients to seek medical care. These are termed chief complaints. Present illness is detailed information about the chief complaints, the current health problem, including the onset of the condition, the duration, the severity, the associated symptoms, and any aggravating or relieving factors. The patient presented with chief complaints, and you have to elaborate those chief complaints with regards to their onset, their duration, severity, associated symptoms, and other aggravating and relieving factors in the section of history of present illness. The next step is to take past medical history and information about the patient's previous medical conditions, for example, hypertension, diabetes, bronchial asthma, any other chronic condition, any previous illnesses, surgeries, for example, if they have underwent appendectomy, cholecystectomy, any orthopedic surgeries, hospitalization, have they been admitted, when, how many times, what was the hospital admission course, what treatment was given to the patient, and what discharge plan was executed for the patient, and any other significant illness should be documented in the section of past medical history. Chronic conditions, allergies, immunization, and any medications or treatments the patient is currently or has previously been taking on are included in the section of past medical history. After completing the patient's past medical history, the next step is to take the patient's family history. Gathering information about medical conditions that run in the patient's family, such as genetic disorders, heart diseases, diabetes, or cancer. This is very important because if there is a clue regarding a suspicion regarding a familial pattern of a disease, and if it runs in other members of the patient's family, then you can suspect a familial trend of that disease and also determine the risk of the patient. If the patient is not currently having the disease but positive family history, you can judge from these information that the patient might contract that disease in the future. Family history helps identify potential hereditary risks and allows for preventive measures or early detection. The goal of the family history is to identify potential hereditary risks and allow for preventive measures or early detection. Social history is very important. Exploration of the patient's lifestyle. These include the patient's lifestyle, whether they are sedentary or whether they are active. What are their sleep pattern, their habits, are they healthy or unhealthy, and social circumstances. Information about the occupation, living environment, substance use, for example, tobacco, alcohol, drugs, exercise, diet, and sexual history should be taken in the social history section. And every single piece of information has its own importance. For example, if a patient is using tobacco, you can judge the patient's risk for cancer, for lung diseases, for heart diseases. Alcohol also carries its own risk, other illicit drugs, whether the patient is doing exercise regularly or not, what's the diet of the patient, and any high-risk sexual history should also be explored in case if you are suspecting sexually transmitted diseases and things like that. The section which is labeled medication history, this section you have to document all medications the patient is currently taking, whether they are the prescription drugs. For example, if a patient is taking medications for their diabetes, for their hypertension, for any other chronic condition, any over-the-counter medications, especially in the elderly, if they are taking over-the-counter pain-relieving medications, over-the-counter antacids, these are very important. So you have not only to document a particular medication, but why the patient is taking those medications. This is also important because this will give you a clue to the underlying condition of the patient. Herbal supplements by themselves carry risks of not only kidney issues but also hypersensitivities. They also have components that can cause serious health issues, so any history of herbal supplements should also be taken. In particular, their drug interactions should be considered and kept in mind. Vitamins, any minerals, any supplements should also be included. And all these help identify drug interactions, allergies, and potential adverse effects. History of allergy is very important. Gathering information about any known allergies or adverse reaction to medications, foods, environmental factors, or other substances. Allergy history is vital to prevent allergic reactions or drug interactions during treatment. After you have completed your history, the last bits of information that you need are a review of systems, in which a comprehensive evaluation of various organ systems aiming to identify symptoms or abnormalities that may not be directly related to the chief complaints. For example, a patient presented with fever, now you have to search for the causes of fever. You can ask regarding cough, sore throat, burning urine, burning maturation, any loose motions, joint pains, so things like that. You have to dig out brief information about various organ systems. It covers areas such as cardiovascular, respiratory, gastrointestinal, musculoskeletal, neurological, and psychological systems. Brief information should be taken from the major systems and incorporated into your history. This is the most important slide. Communication and interviewing skills. Effective communication and active listening are essential when conducting a medical history interview. Healthcare professionals should employ open-ended questions. For example, if a patient presents with pain, ask the patient to describe the pain, okay, and let them talk. Once they have completed, then you can employ some leading questions in order to reach to a particular point. You also have to show and practice empathy and create a comfortable environment for patients to share their concerns openly. The importance of documentation and electronic health records is very important. Accurate and thorough documentation of the medical history is crucial for continuity of care. Electronic health records have transformed the way medical histories are recorded, ensuring accessibility and sharing of information among healthcare providers. This will give you an idea of how to develop a database from which information can be gathered. The patient data is already stored for future correspondence. Also, this large pool of data can be used for research purposes, for guiding health authorities, and for formulating health management plans by observing the records and the trends of the diseases, so that effective preventive and treatment strategies can be implemented for the community. In conclusion, medical history taking is a vital part of patient assessment and plays a significant role in the diagnosis, treatment, and prevention of disease. By gathering comprehensive and accurate information, healthcare professionals can provide better care and improve patient outcomes. Thank you so much.